Are there certain facials that you recommend you should do in your 20s, 30s, 40s?
Now's the time to lay the groundwork so that you are not aging, so that you can limit, your sun damage and your collagen degradation and things like that. So you want to take really good care of your skin, but you also don't want to do too much.
That's how hot that episode was.
God dang it, that was good. Hold on, I gotta put a little lip
Put
gloss
a little
on.
lipstick on. Put a little lip gloss. My
lip gloss is cool. My lip gloss be popping. I stick it in my locker, and all the boys keep stopping.
What would you know about me? What you know?
What song would you like confidently be able to get up at a bar and be like, I can sing every word. I'm positive of it.
That
I'm
song.
gonna not mess it up.
That song.
Nuh-uh.
Yeah, if you like start
Sitting
the
in
music.
8 period, thought I was in trouble.
Something got
Oh,
loudspeaker
no.
on the double. Like, yes, Mr. Clarkson.
No.
Clarkson.
I must admit that bubble gum is popping.
Pat always makes fun of me because I act like I know the words.
You
and I
do.
really just like, I say whatever I think it says.
I am. My
What
song,
about you?
I'm for sure is Fergalicious. I know everything in the rap.
All the time I
know.
turn around, brother's gone around.
I was looking at me, I'm down, looking at me. I just want to
say
say no. I turn around, little drum, little mama. I don't want to take a man.
I know I'm coming off
Just a little bit conceited and keep on
Oh,
repeating.
a little
And the
bit,
boys
a
want
little
to
bit, what?
conceited. And I keep on repeating, and the boys want to eat it, but I try
trying
and
to
tell.
that it can't be true. Okay,
Trying
yeah,
to.
that was
Sorry,
good.
I was like I was sitting on my phone and it vibrated under my butt as I was singing the song. I was like,
did that feel kind of good?
you guys, Dr. Tareen is a genius.
is a fucking badass.
I'm like,
bitch.
and also, side note, she looked so freaking cute in her little dress. And I feel like I think I just had a lifelong of dermatology appointments wrapped up into one episode.
You guys literally don't need to go to the doctor.
No,
after listening.
don't say that.
But actually, like,
Kidding.
no, it was really helpful. Yeah. So I can't wait for you guys to hear everything she has to say about
Also-
skin, aging, Accutane, acne,
Oh my God.
treatments,
Botox,
beauty standards,
daily routines,
the craziest zit she's ever popped in her entire life that had hair.
hair and nails.
What?
Like, huh? How does
Y'all-
that work?
Also, listen to the end because I think, like, yeah, the ending really wrapped it up full circle. So
It really
loved
did. Question. Did you guys hear who we're having on the podcast next week? Did you know that Sophie and I are going to LA literally? When you're listening to this, we will be in LA. Oh shit. Sorry. I just hit my computer. Apparently I'm literally hyped up. We're going to be recording 10 episodes in a sitting.
In a sitting.
No. Like,
back to back, we ain't sleeping.
We're not sleeping. We're not closing our eyes. No, literally 10 episodes in 5 days. And actually though, for some reason, not intimidated by it. I think we're going to be hyped.
It's because it'll be like our full-time job for a second.
I know.
It'll feel kind of good.
It will feel really
I
good.
know.
I know. I'm just
Maybe one day.
Oh my God. And then we get to Jordan's going to laugh at me. Cute coffees and go on walks and work out.
And like our little Airbnb has like a little pool.
I know.
I can't wait to work
Wait,
out
it's
in
gonna
LA.
be really
We
fun.
have to go to Erewhon. Do you guys know what Erewhon is?
Yes, I do.
Oh,
Except
how close is it?
I have to like find some dollar bills in the couch or something.
Oh, actually, same. Can you guys Venmo us
No,
at
don't.
Straight Candid Podcast so we can get a good lunch at Erewhon when we're in LA?
Please, God.
Say for Sid and Soap's lunch. Sid's like, stop it. But please do.
No, I'm like, don't do it.
Y'all think just because we're going to LA, we rolling in bank? Because
No,
let me tell
honey.
you, my bank statement is at zero.
It ain't working like that. So we're going to to LA next week. Freaking hyped. Tareen was on. I literally can't talk because by the way, I'll just go there because it's my straight kind of moment.
Yeah.
I was in New York this weekend. So fun and so necessary. I'm not saying anything, but if you have a feeling you need to go like see your friends, go see them. Don't wait. Like save up the money and go do it. Like seriously, whether it be like something good going on or bad going on, whatever it is going on, go see your friends. Like don't wait.
Probably meant a lot.
Trust your gut and go see your people. I woke up at 2:50 Minnesota time this morning. Confused. Alarm went off. Lost in the sauce. Got on the plane.
Actually,
Guess what I did?
I don't know how you're functioning.
I started Ubering to JFK. My flight was at Newark. It's on the other side.
So what happened?
So because I was like, God, I think I'm on Terminal B. And he's like, there isn't a Terminal B. And I'm like, what do you mean? No, there's not a Terminal B. I didn't get all the way there. Thank Jesus Christ. But then I realized I was going the wrong way. So that's good. But anyway, my straight cannon moment was
Going to the wrong airport.
but this is just, I laughed so hard. Maybe you guys aren't going to laugh. Who freaking knows? We went to the MoMA, which is the Museum of Modern Art. And it's very overwhelming, by the way.
I just ate at Momo.
Really?
It's a
MoMA.
sushi restaurant.
Museum of Modern Art, MoMA. It's like 6 levels. It's a lot going on, but it's so cool. The Starry Night was there. Like, that's sick. Van Gogh's painting.
The one that like has the
swirls. It is there. Like, I looked at it with my own 2 eyes. I think that's so cool. Like,
cool.
I don't know. Maybe I'm like, I'm not an art geek, but when I see cool art like that, I'm like, shit. So
I saw the Mona Lisa one time.
I did too from
but
really far away.
let me tell you, it was very underwhelming.
I was going to say, I'm like, I saw it from far away. I couldn't even get that close. And that was it. She looked at me wherever I stood, and that confirmed.
I'm so confused, like why that, like just the things that become like, you know, legendary. I'm just like,
well, the detail for the time, they didn't have any like technology, and like the eyes follow you wherever you go. It's like kind of like people don't really know how he did it.
Okay.
Okay.
Wow, I didn't even know that. Okay.
So you know what I mean?
Right.
But here's what happened. So we're standing up there, and one of my other favorite artists, Frida Kahlo, is her art's there. She's, you know, like I learned about her when I was learning about Spanish and all these different things, blah, blah, blah. And I'm looking at the Frida Kahlo painting. I'm like, oh, wow, so cool. Like seeing in person. I read it in books and all this stuff. And this kid, they have like lines where you're not supposed to cross. He's walking back and forth in the line. And I'm like, wait a minute. This guy's like, he's like really close to the painting, like really close. Like there's no like rope or like glass.
Like, do you work here?
No, and I'm looking at him, and I'm like, and then I started realizing how close he was, and it's packed. Like people are starting to look at this kid, and he literally lays his head back on the frame. He's like la la la, rolling his head back and forth on the frame, and all of us are just like open eyed, like oh my god, like this is like a very expensive painting, like very expensive, like.
And he was high.
No, he was just he's a little kid. He was just rolling his head around on the painting, and literally this lady goes, is this your kid? And it looks at me and I'm like, no, it's not my kid. And everyone's like, just kind of like, who? And she goes, whose child is this? Everybody like backs up, like looks around like this. I'm like, no, God, no. Like, and the mom was just over in the other room. And I just saw the lady storm over to her, and she's like, your child was rolling his head around on the frame of Frida Kahlo. Can you control your child? It was just so comedy.
When you were telling the story and imitating it with your head back and your eyes rolled back, I was picturing this like homeless man.
Oh,
not homeless man. Sorry. Cancel me. Like someone tripping on shrooms or something.
Or like high in the museum.
Yeah. Like, you know, who wouldn't take a
people
little
do go. That's very
a weed gummy before you go to a museum. I don't know.
Well, you do realize that most of the artists from long times ago were on psychedelics. That's a fact.
They're probably influenced.
Not all of them, but many of them, you know.
That's funny.
Anyway,
oh
I thought it was hilarious. Listen,
God.
that's just like, what the F? Like, control your kid. 1, 2, like, don't touch Frida Kahlo. She's a legend.
Frida Kahlo.
Yeah, remember the dramatic eyebrows?
Oh,
if you know what I'm talking about, that's Frida Kahlo.
Watch how I'm going to spell this. It's going to be wrong.
Frida
Kahlo.
Oh my God.
I did not spell it.
She spelled Frida Kahlo, de Cola, and also Frida de Cola, by the way. She spelled it.
Oh,
and
Frida Cola.
And it literally Coca-Cola popped up. Okay, we're good now. She made it. There she is. That's her.
Oh, wow. She's cool.
Yeah, she's gorgeous.
Anyways, I love it.
That's my straight cannon moment.
Want to hear my straight cannon moment
Yes.
this week? So I had a few ones written down. What did I say?
Oh,
there was another one. One being besides the fact that I order shirts because they look cool, and then
oh my God.
And then realize what they say, like this shirt.
What does
I
it
just
say?
liked the colors.
Let me see. What does it say? Wait, stop. Hard catch, try and get me?
You thought it was cool until you read the shirt.
Yeah, I thought it said like motorsport or something, like motocross.
Yeah, like I thought it was like a motorcycle shirt. And I'm like, ooh,
Harley Davidson.
I love the colors. I love the little brown. I could wear it with like a blue something.
Hard catch.
Shout out to Save for the blue beanie.
Hey.
And yeah, it literally says hard catch. And I bought another shirt from the same place, Addicted or whatever.
Addicted. Oh my God, I was looking at that today.
I don't know how to say it. It's weirdly spelled.
It's like addicted, but it's addicted. Addicted with an E.
No, it's indignant. It's like cursive.
Cursive. Speaking in cursive.
I have another shirt from them that says, I thought it was so cute. I think I wore
Why
it.
didn't
And
you read it?
And it says, boss babe.
Oh, I'm not judging you.
But I still wore it today because it's kind of cute.
It is cute. The colors are cute.
Yeah, I was like, God damn it.
Also, I should say this is my Spoolish shirt. This
is
from Spoolish. This is my friend's company. Yes.
I was literally like, I love that.
It's got a cute little New York Yankee hat on it.
That's adorable. I love.
Thank you.
Okay, but my real straight cannon moment, you're all gonna just fall over with this one. God. Not even fall over, just like feel bad. So yeah, you already know what it is.
I do know very well.
I went off birth control, and you guys know this by now. If you haven't, catch up, girls, catch up. I thought maybe sometimes like repercussions have to happen after you go off birth control, a little Band-Aid. I was having this pain in my left side and I was like, oh my gosh, I think I might have like an ovarian cyst because it started like, I don't know, a couple weeks ago and it was just like a slow oncoming pain. And then I came over to Sid and I said, Sid, I think I have an ovarian cyst. And she's like doctoring me up. She's like actually rubbing on my tummy. She's like, let me take a peek.
Let me see.
She's like, oh my God, Sophie, wait, it kind of feels like, because you could kind of feel it.
It's like a little bubbly.
Yeah. And she goes, that might be like a hernia. And I'm like, oh my God. So I, texted Dr. Sarah, our OBGYN that was on a few episodes, more than one episodes, Vagina Anatomy, haven't listened, go listened. And I was like, I need to get in for ovarian cyst, like x-ray, ultrasound. Sid's like, I think it might be a hernia. So I'm like, do I call the GI? Do I go to my primary care doctor? So I quick made an appointment at my primary care doctor. They got me in because like if it's a hernia, like sometimes it's kind of like, oh, we got to see what's going on. And I go to my doctor and she's feeling in there and she can feel it too, Sid. So you weren't wrong. And turns out
I'm embarrassed. Oh, she just ripped ass. Okay.
Turns out it was.
Are you kidding?
Are you sorry?
Are we at the fucking barn? You dude. What the hell?
I'm so sorry.
I feel like I can't breathe over here. Hold on, I gotta like speak in my microphone and go away.
Here. Sorry, I tooted you guys.
Go. Stop. Tell the story.
Okay.
The air is coming over to me. Tell the story. God.
Oh God, I'm in a weird mood today. Turns out that what she was feeling in my stomach was a hard piece of solidified poop.
What does solidified mean?
Just like
hard.
I guess it like solidified.
Stuck.
It's like a hard piece of poo that was stuck in my large intestine. It had happened from chronic constipation. And I think since I'm going through like that, I went through like the cutting phase. I'm done with it now because my digestion got a little fucked up, which is a sign like, okay, your body's in fatigue mode. Like we got to figure out what's going on. So I'm back up to like my calories going through a little maintenance, but I was high in protein, lower in carbs and fats, and I think it just caused me to get chronically constipated.
Oh my God.
And it continued to back up. So it wasn't a cyst. It wasn't a hernia. It was a hard piece of poo stuck in my large intestine. So she was like, okay, you're gonna have to go through like a colon prep for this, like a colonoscopy prep, pretty much. I could still eat on it, which I was like, thank goodness, but I had to take a few laxatives. I had to drink the 32 ounce of Gatorade with 16 capsules.
Are you kidding?
Of Miralax.
Was it actually that's how much it was?
Yes. I showed you the packet. I'm like, right? This says 16, right? 16 capsules of Miralax. And I took it right when I got home from the doctor because I needed it to be cleared out. And me and Sid had a meeting that day. So I go, Sid, I don't think we can meet at the coffee shop. Like, you're going to have to come to my house.
It wouldn't have been good if we went anywhere else. You wouldn't have been okay.
She gets there and I was like, I'm actually feeling I don't even have an issue yet. Sid, why don't you just fill them in?
The things that I heard and the things that I was a part of just through a door were something of another level. There was atomic explosions on the 4th floor of this apartment, and they were very frequent, very harmful, scary, loud. Like
At one
it
point,
sounded like you might be dying. I'm serious.
I felt like it. And it's crazy because like I didn't realize like that was a lot of poo, you guys.
Well, I've heard of people being stuck. Wow. That is, I've never experienced something like that in my life.
Yeah, I'm so sorry.
And I had to be there. We were meeting. And
I
also had somewhere to go at 6. Go. Oh my God. Whoa. Sorry. There's my Minnesota go for you. At 6. So I was like, well, I just got to kind of stay here. So I'd just be sitting on the couch like this, just, kind of sitting there. And you just hear things. I mean, seriously, like audible, like seriously.
Yeah. I mean, we started like it was just like computer and I would just run to the bathroom. And then there was a point where I just had my computer on my
She
lap.
just went to the bathroom. Yeah. She stayed there.
I just stayed there. Sorry if that was a little too detailed.
Sorry,
Also,
everybody.
sorry if you're listening for Dr. Tareen and you had no idea what you were getting in for because, hey, hello, this is us.
This is how we do it.
We call it straight candid. We call it poo-poo time. We don't, but
that's who we are. And we're going to keep it real and candid and fun. So
let's bring her on though. Let's stop this poop talk.
Let's do this thing. I'm going to read her bio and then Dr. Tareen's going to roll in. So let's do it. Okay, Dr. Tareen is a nationally acclaimed board-certified dermatologist and founder and medical director of Tareen Dermatology. She started Tareen Dermatology in 2011 with a sincere desire to provide cutting-edge yet caring dermatologic care to all of her patients. Dr. Tareen completed her dermatology residency at Columbia in New York. Whoop. She served as the expert dermatologist for WebMD and WikiHow while practicing medical and cosmetic derm in Manhattan. She frequently shares her expertise in skin cancer and cosmetic dermatology.
Wow.
She's amazing. And I hope you learn as much as I did in this episode because holy hell.
Yeah, can't wait to hear what you guys think about it. So let us know.
Let us know. Without further ado,
bring her on, baby.
Here she comes.
Yo.
I read your bio on your website because I was like, wait a minute, I forgot to ask for a bio. Because usually I ask, but I was like, I'm going to make my own based on what I can find. Holy acclaimed.
Oh, you're very kind.
Miss in Manhattan and all the things. Worked for WebMD.
Look at you two.
And Wikifacts.
So oh,
yeah.
We love Wiki.
We love
great.
Wiki. Mm-hmm. Mm-hmm. I will say though, if I have like a headache and I look up WebMD, I think that I might be dying.
It's somewhat designed that way.
I know, because it shouldn't scare you.
Isn't that media that they're trying to scare you?
Yeah, I know. I'm like, great. Thanks for that, media. Media. Okay, you ready, Soph?
I am ready.
Okay.
Oh, we also do straight candid moments at the end of the episode.
Okay.
So we have a listener that wrote in something, and it's about a pimple.
Okay.
It's funny.
It's supposed to be.
We'll just get our reaction pretty much.
Love it.
We just react to it. It's nothing crazy. Like,
if you have a straight candid moment you would like to share, you obviously can.
I mean, 100 a day, right?
Do you have something?
What do we not have?
I know. You're like, oh my God.
When we pull out our cysts, when we show people their lipomas. Oh my God, when we walk in the room and they're terrible melanomas. And we're like, oh my God, how did you not see this horrible black thing on you?
Shoot.
I mean, so there's straight candid really sad moments.
Yeah.
There's straight candid really happy moments. You walk in the room and the patient's acne is gone and they can look you in the eye and they're a new person. That's the best feeling in dermatology.
Wait, that's a straight candid moment right there.
Right there.
That's like a feel good straight candid moment.
Do you get off a little when you pop a good zit?
Oh my God, for
Get off a
sure.
little-
For sure.
I was like, get off what? I'm like, oh my God, I'm so
satisfaction. There's nothing like that
Same.
satisfaction. And I'm telling you guys, I've had 5 kids, so there's nothing like that satisfaction.
My boyfriend will not let me pop his zits on his back.
Why? Will Pat not let you
And
do that?
I don't know. Like some people really love like watching like Dr. Pimple Popper and all those. Like my TikTok algorithm is a lot of zit popping.
Nice.
So
Oh my
I don't know.
goodness.
He won't let me pop them. Is that probably not good anyways to
No,
pop them?
you know, you have to pop them sterilely, you have to pop them properly.
Yeah,
but
I
actually,
don't.
it's very interesting. If you do pop a pimple too much, it can lead to scar tissue and it actually can make that cyst deeper.
Oh.
So unless it's really on the surface and you can lance it with a clean needle, we recommend not popping.
Like, don't
as
pop it.
dermatologist. Yeah, because you're
Oh, we have
making it
so much
worse.
to learn today.
I'm like, oh God. Well, thank you for being here. Everybody got to hear your bio and who you are, but like, can you give your own little synopsis of who you are, Miss Tareen?
Oh, well, I am very lucky. I am Dr. Mohiba Tareen. I'm a board certified dermatologist and dermatologic surgeon. I practice here in Minnesota. I have a couple offices. There's our main office is in Roseville, and then we're in Maplewood, Faribault, Monticello, and we're moving to Hudson, Wisconsin.
Woo!
Wisconsin here. The Tareen Dream dermatologic team is coming.
Oh my God. I love that little slogan.
Tareen Dream.
Tareen sees my whole family, Jordan's whole family, and Jordan's extended family and family friends. And I think it's still spreading.
You're so kind. I'm honored. And
Shit, I better start going to you.
look at how gorgeous you guys are.
Stop.
All of you. I walk in the room for their family and I'm like, oh my God, each of you gets prettier.
Oh,
and
stop
prettier.
it.
It's so true.
I got a little period skin going on right now.
No,
and I was a
stop.
little stressed pre-New York. So I think I got a little reactive on my face. You know, it just happens. It's the thing. It is what it is.
Speaking of stress, hormones, acne, that's a really big driver of skin inflammation.
Yeah.
So definitely we can touch on that.
I just realized you're still wearing your coat. Would you like to keep it on, or are you getting a little warm? Want to take your time?
I'll take it off.
Take it off.
I
was just
may
realizing.
play a doctor on the podcast, but also one in real life, so I'm comfortable without
Yeah.
it.
You're okay with taking off the label.
We don't need the lab coat on.
The white coat.
I love it though. It's cute. A little.
Tareen's got her little freaking pink red dress on.
Oh, my
We were
goodness.
so excited to have you because with everything going on in let's just say 2023 right now, like we've got people still using tanning beds. We have people that think sunscreen is harmful.
Yes.
We've got clean beauty products are like only the thing to do. Toxic is bad for you, and skincare. People have routines that are 20 plus products. All you got to do is just drink more water and your skin will be fixed. Only food will solve your thing. I mean, you name it, it's happening right now. And not to mention the like Kylie Jenners of the world and everybody who has an opinion and is being paid to like show and use skincare.
Right.
It's tough out here.
It's almost like
tough.
it's almost like the health and fitness field that we're in is like there's almost too much information where you're just overwhelmed, so you don't do anything.
Yeah.
Right.
And that's kind of where I am at. Like I don't really have a regimen. Like I have I guess a routine that I've just been doing for years at this point. And all these, like Sid's saying, trends are popping up. Have you seen this star patch zit covering thing
Yes.
that's going on
Yes.
right now? I'm actually really into that. What do you think?
Well, I mean, if it makes you feel better about yourself
Yeah.
and it does keep your hands away from that pimple,
Yep.
why not? And
It's-
it gives you a little
cute.
bling.
Yeah.
Yes.
Have you seen that?
Yeah, I have, but I was just realizing, I'm like, wait a minute, they're used just probably because they just cover it and avoid you from touching it.
Yes. Yes.
Oh, I thought it was like it suffocates it and it kills it and whatever, and like pulls it to the surface. Everyone gives you these facts, and I'm like, is that even true?
Some of them do
Oh.
have some actives in them.
Okay.
Some of them will have benzoyl peroxide or salicylic acid. So I'd highly recommend that.
So those are okay to use?
Yeah,
Okay.
absolutely.
Okay.
As
I
a
love
spot
those.
treatment.
Because I'm a picker. I am a picker.
I know.
You're a
Bad,
motivated
bad,
young
bad.
lady.
I pick my nose, I pick zits, I pick my nails, I pick anything I can pick. So when it comes to zit popping, like if something is just a little on my face, like a little texture, I'm trying to get it out. And I also
help.
don't have long nails. So like I've noticed when I get like fake nails on, it's easier to pop and it's cleaner and I don't leave a scar. But with like these little things, it's these little nubbins. I
The
feel
nubbins.
like I feel like like irritate everything around
Right.
and I cannot get my hands off. So what do you have for tips about picking?
Oh gosh.
Besides don't do it.
So picking really is a compulsion.
Yeah.
It's a feedback loop in your brain. You're not doing anything wrong. It's not like you can't control yourself. It really is there. I mean, as much as you can, you want to cover the area. You want to remember that you're making it actually worse. So we always tell patients, maybe put an ice pack on it, maybe do something else that just stimulates you in a different way.
Why does it make
Yeah.
it worse? Sometimes knowing the why helps me too.
Excellent. So you're manipulating that collagen. You're causing an indent in the skin. So that's what's happening there.
Oh man.
And that's why you get what's called those atrophic, those kind of boxcar acne scars.
Oh.
So it's better sometimes to just let it come to the surface and then just get rid of the little bit of pus at the top.
Yeah.
But
Okay.
it's hard. It's hard. And we have patients that, scratch their skin or people who pick at their hair. That's called trichotillomania. And it's
I've
actually
heard of that.
a really common dermatologic disorder in young ladies and young men. So, and you can cause scarring with that. So,
Oh my God.
that's both a combination of dermatology and you might want to see your primary doctor for like a little anti-anxiety medication.
For sure.
You don't have to be on these medicines forever. People are like, I don't want to take a anxiety med. I don't want to take a depression med. Guys, we're all in this together. Take your medicine. You'll get through. Do you have stigma when you take an antibiotic for an infection? No. So just take your meds, what you need.
Get
We're
to the
all
other
about
side.
that. We're
Yeah.
all about that.
We're totally for it.
I'm on those meds.
I'm not
obviously.
yet, but I'm like, I've been to points where I'm like, okay, but I can probably do it. And then I sometimes can pull myself back, but I know that it's there and I'm ready for it when it's time.
Exactly.
And I'm going to have to use it. I'm likely so I'm like, I'm acceptive of that. And I'm like, I'm ready when it comes. You know what I mean?
Yes.
But speaking of acne, because Soph and I were talking about this prior to the epi, and I don't have experience with this, but a lot of people wrote in too about thoughts on taking things like an Accutane for acne. Since we're on the topic of acne, like, is it bad for you? Is it long-term effects? Is it the best option, basically?
So Accutane is a really loaded topic, ladies. Accutane, do you know what it is?
No.
It's just pure high dose vitamin A. A is an apple. And that vitamin A helps normalize the oil production of the skin. So in people with really significant acne, they're getting extra sebum production, and that's blocking all the pores, and it's increasing the bacterial load on the skin because the bacteria feed on the oil, excuse me. So if you take vitamin A, high doses of vitamin A, it helps those oil glands mature and pump out less oil. So it's really a physiologic thing. Again, just like if you have heart disease, you're going to take a high blood pressure medicine. Accutane helps normalize your oil glands. So you shouldn't have any stigma.
Would you say that's like a first resort, a last resort? Because for me, so I went on Accutane in high school because cystic acne runs in my family. My brother and sister got like baby doll skin. I had my dad's skin, and I would have scarred. Like I have pictures where it was, I like didn't want to go to school. It was,
Right.
I was like, I'll be happy if my face is clear. All I want, mom. I'm like, Mom, all I want is a clear face. And I didn't have my period yet. So I was forced to go on birth control, obviously. So I guess my question for you is, it was like a really big deal for me to go on because, you know, my family had heard of like, okay, well, it can worsen depression. It can cause birth defects. So I feel like a lot of times when people hear Accutane, oh my gosh, don't go on that. Like it's really bad for you. And that's like kind of the secret or the whispers that are happening, you know, on social media sometimes, especially now that we're in like an age of holistic wellness and, you know, just rub coconut oil on your face. So
Well, honestly, Accutane we as dermatologists say, Accutane is the most holistic medicine because it's just high dose vitamin A. People will come to me and say, I just want something natural. And I say, Accutane is really one of the only natural things
versus
that I can give you.
antibiotics.
Correct. Versus antibiotics that'll, interfere with your gut health and all
I
those
got an
kind of
ulcer
things.
from being on antibiotics for acne.
Yes.
Oh,
yes,
man.
exactly. So we as dermatologists like to use Accutane last line, or if somebody's not responding. But of course, if somebody walks in with terrible cystic acne that's already starting to scar, that is something that a responsible dermatologist should go to.
Okay.
So talking about the side effects of Accutane, they can all be, taken care of. So A, in terms of the dryness, we, just moisturize through it. B, in terms of birth defects, you just don't get pregnant while you're on it. C, depression. Depression is really interesting because many recent studies in the past 5 years have shown that Accutane actually does not increase the incidence of depression. It actually helps with depression. There are studies that show people are happier 2 to 3 months on Accutane rather than off of it. So you're helping your depression by making your skin better. Again, you can look people in the eye, you can go to school. It's a life-changing medicine, and I could not practice dermatology ethically without Accutane.
Man, that's so interesting because I've never been on it. I've never needed to. I was lucky for that. But I had a lot of friends and it was very like, oh my God, you're going on that. Like, I can't believe you're going on that. That's crazy. Like scary. You're going to hurt yourself or something.
I took Accutane myself. I have 5 children. I would easily give it to any of my children if they needed it. But it's like any medicine. You don't want to take it if you don't need it.
Yeah. Can I ask why? Do you know why it causes birth defects?
Yes.
Because it's like, if it's so holistic, why would it cause a birth defect?
So any vitamins at high doses, particularly certain vitamins, Accutane's a fat-soluble vitamin, which makes sense because it needs to get into the oil glands, right? So all that vitamin A lodges in the oil glands, but it also lodges in the developmental cells.
I see.
So as those cells are dividing, you can get brain defects and cardiac defects.
I got it. Okay.
So it's just like it's also like you'll see if you girls decide to have kids down the road, like there are certain vitamins you just cannot take too much of when you are pregnant.
Makes total
Like
sense.
folic
Yep.
acid
You want to take
or
enough,
something.
but not too much.
Oh,
Yep. Exactly.
Okay.
Okay. Man.
I do have one more question,
Okay,
Sid,
yeah,
about medication for acne, because another thing that I would say, I'm not even kidding, 50% of my friends are on, including myself, is spironolactone or spironolactone.
Spironolactone, yes.
And that was like, I almost went on Accutane again. So I almost did a second round, but instead I went on spironolactane, which is like a heart pressure or blood pressure medication.
Blood pressure medicine, yes.
Is that, I've heard that sometimes it can disrupt like certain androgens or hormones in your body.
Excellent question.
And so I'm like a little afraid of staying on that. And that's something I'm like, I went off birth control. And now I'm like, do I need to get off spironolactone? Because I do think it's really helped my acne. How do I say it?
Spironolactone.
Okay.
Also known as aldactone. They're synonymous, spironolactone, aldactone. Spironolactone is a blood pressure medication at high doses, at much higher doses than we use it for acne. It's used for, at lower doses, it's used for acne. At higher doses, it's used for blood pressure. I have taken Spironolactone myself for over 20 years.
Oh, wow.
And knock on wood, I've been very fertile, 5 kids. You know, you just don't take it when you're on it. And Spironolactone is great because it doesn't disrupt your internal hormonal milieu. It disrupts the hormones in the skin. So it blocks the conversion of dihydroxytestosterone in the hair follicle.
Oh,
in
so
the
not
oil glands.
not inside, just on the
Just
surface?
on the skin, just like in the response of the hair follicles and the oil glands.
Okay.
So again, you don't want to get pregnant when you're on it, but people have gotten pregnant while they're on it and it hasn't caused any significant birth defects.
Okay.
So it's
that's
a
good.
really safe medication. Love it. It also helps, many women not have to do a second course of Accutane.
Yep.
Men cannot take Spironolactone because it can cause disruption in some of the other testosterone types of things that we as women don't have to worry about.
Oh, I did not know
So
that.
there's a new topical class of spironolactone analogs, calcicoterone, those types of things that men can use topically.
Yeah.
They're really expensive and they're not as good as oral spironolactone. So I still prescribe oral spironolactone, which is super cheap, right?
Yeah, no, I literally love it. It makes, if I went down in my dosage, I noticed like a flare up right away.
Correct.
Yeah.
And do you know a couple other things? Spironolactone helps with female pattern hair loss too. Not something that you guys have to worry about, but many
Well, me, I
stuff.
have extensions. That's fine.
Whatever. They look real.
They look great.
You look bomb.
But yes, because it blocks the dihydroxytestosterone conversion in the hair follicle, you don't get that female pattern hair loss that many women at my age start to experience. So we use spironolactone all the time for female pattern hair loss too.
Wow. Good to
What
know.
if you're a male and you can't take it? What would you
What do you-
recommend? What if
There
they're
are,
listening?
there are a ton of things that we do for pattern hair loss in addition to spironolactone. There's PRP, which is platelet-rich plasma, which are stem cells. There are different lasers. There's finasteride. There are hair caps, like those low-level hair caps. So there's a ton of things. But spironolactone is great for somebody like me who still gets adult acne, but also has hair loss. So good.
Dang. Okay. Well, okay. Switching into aging, because all good things about acne, but aging, we got a million. I mean, I'm not kidding you. Probably 100 questions about
Million.
do I need a retinol and when do I need to start using it? Like literally, it is the obsession right now. And I'm talking all
Absolutely.
retinols or retinol likes, like tretinoid
And what is
all
it?
things.
So retinols are like Accutane. Retinols are topical versions of vitamin A.
What do you know?
So just like the oral Accutane is helping your oil glands, it's helping your follicles, everything. The topical vitamin A gets into the nucleus of the cell, which a little primer. The nucleus is that center part, the kind of the center brain of the cell. Retinols get into the nucleus of the cell and they help increase good protein transcription. So they help increase your collagen production, your elastin production. So they help all the good things while getting rid of all the dead skin cells, getting rid of all like those old dead brown things that we get on our skin.
When should I be taking, like, or not taking it, putting it on, like using it as a topical? Because how quickly? Because some people say use it as soon as like 22. Some people are like, wait until 40. You know, you don't need to do that. What is the right answer here?
So you should start your retinol as soon as your skin can tolerate it. We have teenagers start retinol for acne and pore size, and they have done longitudinal studies of these people who've used retinol, since they've been teenagers, and they always look 10 to 15 years younger than their age and sex match controls. So
Whoa.
yeah, you should
This
see
is
the
this-
twin studies on retinol. They're amazing.
Oh, that'd be cool.
I would be pissed at the twin. I'd be freaking pissed if I was the other twin. I'm aging. The other one's like not. I'm like, what?
From such an easy thing that you just put a little cream on at nighttime.
I
So
know.
here's my issue. This is the same thing as tretinoin, right?
Tretinoin is a class of a retinoid. So
Okay.
retinols are a little weaker. They need a couple more enzymatic conversions to get into the
Yeah.
cell. Retinoids are a little stronger.
Okay. So I have the I'm saying it wrong.
Tretinoid.
Tretinoid.
Yep.
And what happens to me is I use it and then I get really dry and my makeup doesn't go on very well and then I stop using it. And I also always notice really bad eye infections almost that I get because my eyes are really
Interesting.
dry.
Yes.
I put Vaseline around my eyes and then I put it on. I like really want to use it, but it's almost like I can't put my makeup on and then my eyes really dry. So I don't know what to do.
So there's a couple things here. So number one, there are some people who are just too sensitive. Some people with rosacea, eczema, they just cannot tolerate a retinoid. So the other things you can do are alpha and beta hydroxy acids, azelaic acid. There's some lighter retinoids like Differin that you can maybe try. So you can go lighter. But there's
Yep.
also something called the sandwich technique. Have you heard of the sandwich
Yes,
technique?
I've been doing it.
It helps so
And
much.
I have psoriasis
right?
and I can use it. It works.
Tell
Okay,
everyone what the sandwich technique is.
so-
What's the sandwich technique?
The
Sid?
sandwich technique, just like a little, Oreo or a sandwich that you eat.
Yes.
You use some sort of I use a moisturizer or a serum. They say either or, but you can correct me.
Yes.
And then you put your tretinoid, retinol, whatever it is on, and then you use another moisturizer or serum to sandwich it together so that you don't get so dry.
Okay, I do that.
And for some people, like some people my age, they just get dry like in a certain place, like around
Yep.
their mouth or around their eyes. So
Yep.
they'll do the base all over. And some people say to me, hey, doesn't that make the retinoid less effective? They've actually done studies that have shown it carries the retinoid deeper into the skin cells. So
Because
you're
it's
not
absorbing.
diluting it. Exactly. And then for the third layer, the bread, the third piece of bread, you just do it where you get dry. So you don't have to do it all over.
Do you guys want to hear a crazy story?
I would love.
So I got a chemical peel done it was like maybe the beginning of high school, and
God,
it like
really?
burned my upper lip. So like I got like a red mustache for like months.
That's
And
so
whenever
stigmatic.
I sweat now, I get this like red mustache still to this day.
Wait, I've noticed
Yes.
because we live together. Like it's not like I'm like, but I'm like,
We
wait,
do.
what the?
It's
F?
like
a
this
thing.
It's like a pale part, and then it's like really red. And I can't put tretinoin on there because it's
Right.
like really sensitive.
Right. You've got like almost like post-burn, like a post-burn
It
syndrome
was-
there.
How
many
Yes.
years ago was that?
I should sue these people. How
many years ago
Just
was
kidding.
that?
I wouldn't. Like it happens, but still.
Poor
But
girl.
when we do peels in my office, we always do a layer of Vaseline right there.
Oh my
so
God,
it doesn't
because-
penetrate in because we know that there's increased absorption around the oral mucosa.
Yeah.
Oh my God.
Yes, that sucks.
Okay, so speaking of these, because this is
Yeah.
like a really good segue, because people are like, well, I'm 20. What should I be doing? I'm 30. What should I be doing? I'm 40. What should I be doing? Well, everybody should be using a retinoid. Now
If
we know,
they
or
can.
retinol,
If
if you
they can.
can.
If they can.
Also, side note, would you suggest a brand or would you suggest using the dermatology, whatever, you know what I'm trying to say,
So-
brand?
I think a nice little segue for people, if they want to start with a light retinol, Differin, Differin, used to be a prescription retinol, and now it's over the counter. So you can start Differin, that's available over the counter.
Okay.
ROC Rock makes great retinol. Neutrogena makes great retinol. Nat, any other suggestions?
I mean, I think anything medical grade is what I prefer. Is something that's like a little bit more pure in nature. So I mean, I'm not really
Medical grade and pure.
Roche-Posay has a good one.
La Roche-Posay has a good
Oh,
one.
yeah.
Yeah.
Mhm.
So, like, after you've done like your over-the-counter gentle one for a few months, you might want to go into the derm and get a prescription strength one because they are definitely stronger and they're different strengths. They can titrate up your strength of your retinol too.
That's amazing.
Yeah.
Okay.
So-
So maybe I'll just dilute mine for a bit and try that.
For
Yeah.
sure.
Still do the Vaseline around my eyes, still do the sandwich technique and see how that is.
And start
try it
once
out.
a week. Like once a week of retinol is better than 0 times a week of retinol.
Yeah. And then
Right?
increase it to twice a week. And
Yeah.
then
Once a week for 2 weeks, and then
do
twice
you
a week.
usually
for
have
2
every
weeks.
night now?
I even, doing retinol for 20 years can only use mine about 3 to 4 times a week.
Okay.
And obviously in summer you can use it more because it's, more humid, more sweaty, and in winter you use it less.
Interesting.
Speaking of the
Okay.
chemical burn and like the chemical peel, you talked about that you do that at your office. Are there certain facials that you recommend you should do in your 20s, 30s, 40s? Like what would you say for that?
Absolutely. So now is the time.
And
when
for
you're-
different skin problems. I
Yes. Now is the time to lay the groundwork so that you are not aging, so that you can limit, your sun damage and your collagen degradation and things like that. So you want to take really good care of your skin, but you also don't want to do too much. Like you don't want to be getting peels every week and getting burned. So we really like a gentle regimen that incorporates retinol. Hyaluronic acid is really nice, and vitamin C. Those are great kind of mainstay products that are antioxidants, that are humectants, that are anti-aging. So,
Okay.
and then a little bit, maybe a couple times a year, you might want to get a hydrofacial. You might want to get a glycolic peel. If you have some acne scarring, you might want to do what's called microneedling. Skin pen is the other word for microneedling.
Oh yeah, I did that one.
It helps a ton, doesn't it?
I mean, I felt great. It was slightly uncomfortable on my neck. I won't lie.
Yes.
But I mean, I lived. I would do it again.
lived.
So, it's like, it is a little uncomfortable. They always say beauty is a little bit uncomfortable, right? But it wasn't like, oh my gosh, I'm in pain.
Have you guys heard of tech neck? TECH, tech neck?
No.
That's like when you get into your 30s and definitely in your 40s and you start getting lines across your neck from looking down
yeah.
at your phone. So microneedling is a great stop.
You don't even have it over there.
Stop.
Stop it.
Stop.
You mentioned hyaluronic acid.
Yes.
And I honestly thought this was an acid I put on my skin. It would burn my skin off for years until, no, I'm not. And
No,
I
I
feel like
get
people
it
listening.
because I feel this.
I feel like
I
people
feel this.
listening might be like, wait, did you say put acid? Like,
Yes, right.
So can you talk about hyaluronic acid again quick?
So hyaluronic acid is part of our skin. It's part of our dermis, our collagen. And hyaluronic acid is what keeps the skin plump and moist. It makes you look juicy. Like you look at 3-year-old kids' cheeks and they're a little cute and juicy.
I know they are.
Because they're full of hyaluronic acid. And as we get older, that hyaluronic acid degrades. We've got all these enzymes that are degrading it from sun and smoking and chemicals. So you want to put hyaluronic acid on your face, but hyaluronic acid is carried in by water. So you don't want to just put it on dry skin. You want to get out, you want to be out of the shower. You want to have a little damp skin so it really pulls it in.
Can you take it
wow.
orally?
You can take it orally, but it's degraded by your GI enzymes.
Yeah.
So that comes to a topic people my age ask me all the time. Do you take oral collagen? Do you guys take oral collagen in your teas or anything
Yeah, I
like
do.
that?
Mhm.
So the studies have shown that it is for the most part degraded in our GI tract because it's a big protein. So,
Wah, wah, wah.
but I still take it myself.
I know, I'm
'Cause-
like, it is a form of protein. So I'm like, okay, it's still good, but like maybe it's not doing everything it was set
I
out
just
to
eat
do.
my bones
Right. No, that's
and bone broth.
natural is always
Yeah.
the best way. But if you're like not doing that a little
Yeah.
bit and it keeps you full.
Yeah.
Mm-hmm.
So people ask me all the time, Dr. Tareen, do you take collagen? I say, I do take it. The studies are out, but it's not going to be harmful.
Okay. So it's fair enough. So I can keep putting in my coffee and it's still going to give me a protein. It might just not make my skin like my hair grow like a weed or whatever.
Right. The
Okay.
claims may be a little exaggerated, but they're not bad.
Okay, fair. Okay, so breaking it down, 20, 30, 40-year-old, let's like just quick do them.
Okay.
And they might be the same. That's kind of the point I'm trying to prove. It might
Yes.
not. I don't know.
Yes.
But it's like all I've learned is like hyaluronic acid, like from also I read way too much. So I need to like relax. But like vitamin C and then like moisturizer, sunscreen.
Absolutely.
At night,
always.
swap out, I think, your vitamin C for your retinoid.
Yes.
And I do it every 3 days, I think it is.
Amazing. So
I'm
you're
in my
already
20s.
skin cycling. You're
That's
quote
skin cycling?
unquote skin cycling. That's exactly
even know
what
what it
skin
is.
cycling is.
I was going to ask you what it is. I don't even know what it is.
It
That's
has
what it
it
is.
has really
Just
good
switching.
marketing behind
Oh my
it.
God,
But skin
I'm so
cycling
dumb.
is what you're already doing, where you don't do all your actives at one time. I mean, it makes sense. You're not going to do 10 workouts at the same time.
Yeah.
Right? You want to do
Oh no.
a little bit at a time. So that's what skin cycling is. Do your retinol a few times a week. Use your hyaluronic acid. Definitely use your vitamin C in the morning. So 20s. I think 20s is all about prevention. Sunscreen is the most important thing. Don't go in the tanning bed. If I could say one thing in your 20s, don't go in your tanning bed.
They
Because-
literally put them in apartment complexes, by the way,
Gross.
for college students. Isn't that cute?
Gross.
Isn't that cute?
Gross.
Mhm.
Okay, give us the why.
Tanning bed exposure is so much stronger than natural sun. It's not giving you any of the benefits of natural sun. There was a study that showed, it was actually at Mayo, that one tanning bed exposure increases your risk for melanoma by 10 to 30%. That is
Oh my
one.
God.
People come to me all the time and they're 30, 40, 50 years old and they have melanoma like in a funny place, like under their breast or, somewhere on their back that doesn't see the sun. I say, have you been in tanning beds? And it's almost always yes. It's a resounding yes.
Wait, so can I ask a question then? Because when I was in high school, it was a thing.
Yeah, I
And
did it in high school.
I did it in high school. I'm not going to lie. I totally did. And a lot of my friends, honestly, probably everybody I know basically did.
Everybody did it before dances, right?
Yes, that's what we did.
Everybody. Yes, it was like a rite of passage.
Well, my junior year of prom, I was like, my mom was like, don't go into tanning bed. My dad's like, don't go into tanning bed. I'm like, fine. So I got a spray tan.
Nice.
It was the worst spray tan ever because it was like new and
course.
upcoming. No one knew what they were doing with spray tans back then. I was orange. The pictures, I should show you guys. I should post it. It was absolutely horrible. So then the next year, for senior year prom, I secretly had to like tell my parents lies so I could go in a tanning bed. Isn't that messed up?
Isn't that bad?
Your parents are smart people, though.
I know they
Man.
are. They really.
I know, we
my
gotta
dad.
listen.
My dad definitely knew what he was talking about. So I just want to talk about this again because you guys literally brushed over this like everyone knew what you were talking about, and I'm sitting here
Skin
like,
cycling?
I'm sorry, what? You're like vitamin C, hyaluronic acid. You need to do that one more time.
No,
Okay.
yeah, do 20, 30, 40.
Okay.
We'll finish the thought. I know, sorry. We get so excited because there's so many things to learn. I get so excited.
There's so many things to talk about in
I
skin,
know.
which is why I love my job.
I know. I would too. I'm not going to lie. If I could go back, I would become a dermatologist.
I'm gonna be real.
I'm not even kidding.
It's the best thing
I didn't even
ever.
know you could talk this much about skin, but like we could go for days.
We could go for days.
I know.
Okay, so 20s. You should do sunscreen. You should do your vitamin C in the morning, every morning. That helps protect against sun damage.
Even if I'm not going outside.
I mean, it's still beneficial. You're still
Okay.
getting ambient exposure from windows.
Okay.
There's increasing data that even light is causing a little bit of sun damage, or not sun damage,
So
but damage.
vitamin C for sun protection or sunscreen. What?
Vitamin C under your sunscreen.
Okay.
So vitamin C first.
What's
and then
that
your
for?
Sunscreen. The vitamin C is an antioxidant.
Okay.
So it helps with preventing free radical damage from light, from
Okay.
pollution, from those types of things.
And that's like a little dropper, like a serum vibe.
That's a little serum.
Okay.
You can get, there's some lighter lotions and things like that. You should look for vitamin C that's at least 20% active.
Okay.
Got it.
Okay.
Good to know.
And vitamin C is degraded by sun and light. So keep your vitamin C like in your closet, in your bathroom,
Oh,
like
good to
away
know.
from light.
Good to
Okay.
know.
Yeah.
Okay.
Because otherwise you're
Vitamin
paying
C.
a lot of money for it and you're not getting the
Yeah.
actives.
Vitamin C sunscreen.
Vitamin C sunscreen morning. That's your, and then make sure you have like a powder or some type of lotion that you're applying, reapplying through the day for your sunscreen on your hands and
I
your
just got
face.
one. Oh my God, I'm going the right direction, you
So
guys.
many people get so much sun damage on their
Mhm.
hands, and their hands end up showing their age, ladies.
Okay.
Okay.
There's a powder that's sunscreen, by the way, that I can show later, but it's like Go Glow. I think.
Yes.
Or no, that's Sartane. No, well, there's a blue one, but there's a white one. I forget the brand. It's like a.
You can
yeah.
post it.
I'll post it later,
Yeah,
but
those
it's a powder.
sunscreen
It's
powders
good.
are, and they like make your skin glow.
Okay.
So yes, in terms of procedures, you might want to get a little light peel every couple months if you're acne prone. If you are prone to dehydration, you can do a hydrofacial. Those are really nice and they pull out little debris. If you have acne scarring, again, we can come back to microneedling, but I would start with that. In your late 20s.
Wait, what do I put on at night?
Oh, sorry. Good point. Our holy grail, our retinol via sandwich technique. But you might want to cycle that
Sandwich.
every other day. And then in the nights in between, you can just use your hyaluronic acid.
And so skin cycling literally just is having different days using different active products. That's it.
Correct.
Okay, so it is a good
Correct.
thing. It's not a fad.
It's not a fad. And
Good.
dermatologists have been recommending this for years, as you know.
So at night, I'd put on hyaluronic acid and either my lotion or hyaluronic acid, my retinol, and then my lotion.
Correct.
Okay.
Correct.
So that's what I do at night.
And
Got
you may
it.
not even need extra lotion. Your hyaluronic
Yeah.
acid could just be your lotion.
What lotion do you recommend?
We like gentle lotions because your lotion doesn't have an active in it. Your lotion is just your
What do you mean? You keep
moisturizer.
saying active.
So active is a molecule that affects change in the skin cells.
Okay.
So be it a hydroxy acid, be it a retinoid, be it a vitamin
okay,
C.
got
So
it.
actives like change something. Moisturizers just hydrate.
Got it.
Do you like CeraVe?
Love CeraVe.
Okay,
I
because
love
I mean,
CeraVe.
it's people are always like, "Oh, there's a question later." I don't even want to get into it. It's about drugstore brand, but
CeraVe,
regardless.
Cetaphil, Vana
Okay.
Cream, La Roche-Posay. There's some really good over-the-counter ones.
and you can
I
go to
use
Target
that.
for these things. You don't have
Yeah.
to go to Macy's or Nordstrom. No shame to them. I'm just saying they're expensive as hell. So
For sure.
Something
And-
about
Okay.
the CeraVe one that's like in the big like circle you can dip your hands
Yes.
and like finger the lotion.
I'm
in
like
there.
more of like a.
No.
I get the like little pumper, and I'm just like
Have you had the one?
like,
the, like
in the bathroom. For
what's
like
it
10
called?
minutes.
The one
The
that's
tub.
like the tub, and
Yes.
it's like extra moist.
Oh, yeah,
it's
I've
so
gone through
creamy.
those.
It reminds me of like Skin Cuticles, which I have used.
Yes.
The triple lipid one.
Yes.
But
Yes.
it's
Love
so
that.
it's so expensive. So I was like, I did the CeraVe tub one, and it feels almost the same.
It may not have exactly the same
Same
feel,
ingredients.
but you're getting the same
Yeah.
effect out of it.
Okay,
I
good
love
to
the
know.
Skin Cuticle one.
Okay, 30s, 40s, really quick.
Okay.
What changes?
30s and 40s, your skin loses its hydration. We start getting more collagen degradation. This is the time where you want to start doing some light procedures like
Okay.
Botox or Dysport, Xeomin. Those are all toxins, which sounds really scary, but they work at what's called the neuromuscular junction, where the nerve and the muscle connect, and they help relax the muscles so you don't get those deeper lines.
Yep.
You might want to start doing a little bit of filler because a lot of women start showing their age under their eyes. I don't know if you've seen like some 30-year-olds who look tired after kids. It's because they lose volume right there.
A lot of people wrote in about how do I get rid of the under eye.
Yes.
Like, I mean, and I think maybe there's not totally an answer to, I mean, you're supposed to moisturize under your eyes, right? But maybe it is just you're losing.
Well, under eye
Substance
is like, it's again multifactorial, right? You might have pigment, you might have darkness, you might have volume loss, you might have, age spots. Like there's a lot of things that you might have to address with under eye.
Okay.
How old are you, by the way? As I'm staring at your skin.
I am 43.
Wow.
Stunning.
Okay.
And
And I
5 kids. I can't even
I
fucking
would
believe.
look much younger without these children.
Oh, stop. Oh my God. You're kidding me. Okay. So then 40s and into 50s. Like What are we doing?
So we are talking, you want to keep your good skincare, you want to keep your sunscreen, no smoking, good nutrition. People forget about nutrition. You need to be getting your proteins. You need to be getting your vegetables. Now is not the time to be on a diet. I mean, not to be crass, but it is like face or your ass, right? Like you don't want to get too thin.
It's true.
It's true. It's very true. But you might want to think about procedures. A little bit more filler. You might be getting microneedling or lasers to get rid of brown spots. To get a lot of Caucasian people get little broken blood vessels starting at this age. So you might want to laser those red spots away.
Question for you, just because I'm thinking about, because you're pointing to your nose. I have freckles on my nose. Is that something I should be alarmed for? Because my next question was going to say, like, when am I going to see my dermatologist? Like, when should I know when to? Okay.
I only
your
go when I
freckles
need
are so
Get
cute.
in there.
Yeah,
Oh,
I love your
thanks.
freckles.
Thank you.
I
I
don't get rid
literally
of them.
Really?
only
Okay,
go to the derm when I'm like, oh, my prescription's up lately.
When
But
should
I
we
need
be
to stop.
going?
I
I
need
You
to
know.
should start
doing
going
that.
now. Now is the time.
Okay.
Like after the age of 18, especially being relatively fair skinned, both of you, having had some tanning booth exposure, you should, as long as you're getting
Not
your
proud of it.
prescriptions, you might as well get a full body skin exam. It's a
Yeah.
pretty, it sounds really invasive, but it's just like the doctor just looks at you and you flip over and then God forbid you have something funny on your back that you can't see changing. Now is the time to get rid of it.
How does this all work with insurance, by the way?
Excellent question. Insurance sucks.
Yep.
We knew that.
But like a full body checkup is preventative, right? So that's usually covered.
Oh my God. One would think. They did a study.
You're kidding me.
Finding a pre-melanoma costs you or your insurance about $300.
Okay.
Do you know how much treating one melanoma costs per year?
No.
$1 million per year. Because the chemo and the surgeries and the radiation for melanoma can be so expensive. But these full body skin exams are not considered preventative in the state of Minnesota. In a couple states, like Illinois is one of our neighboring states, they
I'm
cover
pissed.
full body skin
It's
exams.
not always been like that, has it?
It's relatively like that in Minnesota in all the years.
Is it
that
all
I've been.
insurances or just certain insurances?
Most insurances. Most insurances. I think that
Because I
pisses me
always
off.
learn like, yeah, it's like preventive to go get your.
it's considered a preventative thing, but
Yeah.
it's not covered at a preventative level, which means that you pay nothing for it. No, you have to pay for it.
Oh my
Sucks.
God.
So for me though, it'd still be like my insurance is copay, so I would be okay. It would be like a $35.
Yeah,
probably.
But not
Okay.
everybody's as lucky as you. And so
Yeah.
many people have such high deductibles
Yeah,
these
I know.
days.
Don't
And
pick
it's-
high deductibles, young people. Just
know.
saying. Try to get the copay stuff or do a low deductible.
There you go.
Stay on your parents'
HSA,
insurance
that's
as
all I
long
gotta
as you
say.
can.
Yeah.
HSA. Once you got an option for an HSA, start doing it.
Yep.
You talk about melanoma, and I thought like, okay, this is like, maybe you have a creepy little mole or something like that. Like, and then, and it looks funky. And I'm going to ask you what to look for in a mole, but like you think it's not going to happen. And then it just happens. Like my dad, I would say normal human being, never went in a tanning booth. Does he take care of his skin? He is a boy and grew up in a different era. So I would say not really. He uses like hand wash in the shower. So like there, use your imagination with that. And he like doesn't wear sunscreen. He had like a weird little patch on his face. Turns out it started growing and growing and growing. And he's definitely not like a doctor guy. And we're like, okay, you need to go in. It was melanoma. It was huge on his face. And he literally got like a facelift on one side of his face because they got it out. And it didn't spread. And that is like so lucky. So like if you see something funky, pay attention to it. What are you looking for?
So today is Melanoma Monday. May 1st is Melanoma Monday.
Wait,
This
what
is
are the odds?
Yeah. So thank you for having me on such an important day. Melanoma is one of the fastest growing cancers. The rates of melanoma are skyrocketing a lot because of tanning bed exposure. So we definitely want to get on this. And not just women get melanoma, men get melanoma. And do you know men die from melanoma at a higher rate? Because their melanomas, just like you said, are
my
caught at a
God.
later stage. So getting your data in is so important.
I had to bug him.
So have you guys heard about the ABCDEs of melanoma? This is a great rule of thumb, and maybe like you can take a screenshot and post it on your on your socials. So A is asymmetry. If a mole is asymmetric, you should have it checked.
Okay.
B is border. B is in border.
So I
if
have
it's-
learned this.
Yeah, if it's jagged at the border or one border doesn't match the other. C is color. You don't want really dark moles, nor do you want multicolored moles.
Okay.
D is diameter. It should be a mole should be smaller than a pencil eraser for the most part, 6 millimeters. And E is the most important fact of skin cancer, evolving. So if something is changing, if you've got a mole that's changing, you should get in.
Man. Okay.
We should have tried to guess that. I would not have.
I would have never gotten
not
it.
have- I have where are we at in this, by the way? Can I
I'm
ask
coming
a
down-
do you want
you
me to
can-
ask a random question? Is
You
that
can ask
cool?
a random question because I'm going to come down to product and procedures real quick.
I'm just gonna spice it up because I need to know like the craziest zit you've ever popped.
OMG.
Or like the craziest
cyst, right?
thing. Like the craziest thing you've ever popped and what happened.
I'm scared.
Just because maybe this little ASMR, people like pimple popping videos, let's see if we can like describe it.
Yes. So once I was taking off this thing and I
Trigger
thought it was
warning.
going to be a cyst, and then it was actually what's called a bezoar. So it had like
What's that?
hair and nails and a
Nails?
red, and it was like it's like an aborted fetus almost. So like
What?
it was so
Where was
cool. It was, I think, on the lower abdomen. Yeah. I don't
How
remember
big
because it
was
was
it?
all
Did it
good.
have eyes?
It did not have eyes.
No.
But
What
it
was
did have
it?
like everything. It's like a, aborted type of
Like
fetus
just
type
body
of thing.
part
Yeah, body part
things?
that got like, yeah.
So do you cut it off or
Yeah,
pop
you cut it
off?
out. You numb it, you cut it out. It's really satisfying.
Wow.
Also, another weird thing I noticed. So my dad, when I grew up, we
that
always
was a thing.
made fun of like his like skin tag in his armpit.
Oh, your
And,
poor
I
dad.
mean, no, he literally thought it was funny. He's like, "Man, I'm gonna chop it off, whatever." And the other day, I was laying in my bed like this, looking at my armpit, thinking I looked sexy to my boyfriend. I was like, hand behind the head, and I was like, "Hey, babe." And, then I look at my armpit, and I have the teeniest skin tag.
No,
And I'm
you
in
don't.
the exact same spot my father had a skin tag.
Karma.
And I thought,
That's karma.
so I literally was trying to pinch it off. And
Don't pinch
can you?
it off.
Let's see if I can.
Oh my God, stop. It's
I can't
like
find it.
not
Do you see it?
visible.
It's
No.
literally smaller
No.
than an
You
armpit
guys,
hair.
it's because I pinched it off.
No, it's
Is that
not.
What do you do if you have a skin tag? Can you just like chop it off?
You can tie a little string around
Okay.
it. You can like use a little bit of like, they have some over the counter stuff, but you have to be careful because a
I know.
lot of times people come to me afterwards because it gets infected.
Oh,
ow.
So just be careful.
Okay. So
Okay.
just wanted to let you guys know about that.
Question, because I've got psoriasis, and I know my sisters out there with psoriasis and eczema are like out here saying like, please help a girl.
Yes.
Because here's my thing. I have dark hair. This is my natural hair color. Yep.
My
Picture it.
friend texted me today knowing you were coming on, and this is her psoriasis
It sucks.
on
And
her face. Yeah.
I'm lucky I don't get it on my face. I get it on my scalp really bad, my elbows. I used to get it like on my neck if I was really stressed on the back of my head. And even when I'm like, oh, I'm doing really well. And then they find these weird like patches on my head, and they bleed and they hurt. And
Yes.
it hurts when I shower sometimes. Like people don't realize it's like this weird random thing. I use all the clinical stuff. I got really good stuff from you guys, but is there anything else like I should be knowing that I'm not paying attention to? Do you have some? Oh, Natalie's like, yes.
Yes.
But also, like,
it's really important vitamin D level. And that's something that
excess
people
skin.
don't talk about with skin. Vitamin D acts as not just a vitamin, but a hormone for skin. So if your vitamin D levels are low, which many of us are in Minnesota because we're not outside and
my
we're doing
God.
good sun protection. So I really recommend you get your vitamin D levels checked
Okay.
and we supplement you.
Okay.
Like I take 50,000 IU of vitamin D a week. That's a
D3?
lot. D3.
Okay.
Yep. That's the most bioavailable.
I'm buying D3 right after this.
But I want you to get your levels. You should
will.
get levels because if you sometimes will be surprised how much you have to take to get your levels up. And that sometimes just fixes your psoriasis.
No way.
I was
'Cause
gonna say, to me, it sounds like the psoriasis is like no one knows where it's coming from. No one knows
Yeah.
like what it's from. But is it mostly because of vitamin D? Is that the reason, or is it sometimes like
It's a cofactor in
Okay.
that, but it's genetic. We kind of know the
Yep.
gene loci. And now like you probably see all these commercials on TV, like ask your doctor about Humira, ask
Yeah.
your doctor about Skyrizi. And those medicines are smart and they target those gene mutations, but they also unfortunately target the immune system too. So these people are at slightly higher risk for cancer, infection. So as long as you can stay off medicine,
I
it's
try not
great.
to. So far, so good.
My-
and anything different for eczema? Sorry.
That's
I
okay.
just
My
wanna see.
friend is on Humira
Yes.
for psoriasis because she was like, that's the only thing that works.
Yes. What are you going to do? You have to
Yeah.
take it.
Yeah.
And Humira's been on the market for 20 years.
Wow.
So it's safe, you
Yeah.
know.
Okay.
So.
Anything different for eczema? Was that what you were
Well,
going to say?
no, I was going to say what light therapy.
Yeah.
Light therapy. What is it? What's the red light therapy, right?
There's red light, there's blue light, and there's narrowband UVB. So there's different wavelengths of light that we can harness in dermatology to help fix things. So narrowband UVB has been around for 100 years.
Oh, wow.
Amazing. And it helps fix psoriasis. You go in a booth, it helps fix eczema. So it helps with all these inflammatory skin disorders. There's blue light, there's red light. Those can target acne, anti-aging, anti-inflammation. But for the most part, for psoriasis and eczema, we use narrowband UVB.
Okay. Amazing.
And those studies have shown that these do not increase your risk for cancer.
okay. I have like 2 rapid questions, then I'm going to do a little this or that. Is that okay?
Great.
Okay, quick. All over body anti-aging. That's something that a lot of people wrote in. Like, what am I mean, I use lotion and I checked it and it's like medium on the clean scale ish.
Yep.
Nivea, like shea butter, I think it is, and like firming moisturizer. That's what I use. Is there something we could be doing for all over aging?
I
Or
mean,
no?
what are you going to do? You
Don't crisp out. in the
yeah,
sun.
right.
Just lotion,
Don't-
right?
Just hydrate, get your diet right. Don't go in the tanning booth. That's it.
Okay, so that's all we can do.
I mean,
okay.
you can use, I love, one thing we didn't touch on that I think a lot of your readers probably have is something called keratosis pilaris, those bumps on the
Yeah.
back
I have
of the
those.
arm.
I have them.
So many people have
So
those.
many people have those. They estimate about 20% of the population
My
has
boyfriend
that.
has them all over his
Yes.
arms. Yeah.
Jordan has them really, really bad. I have them okay. It's usually only one arm. I thought it was related to dairy.
It's, if you have an allergy, it can not
Okay.
an allergy, but a sensitivity.
it?
Can, so it's just the prominence of the hair follicles, and it's in some people a little sign of minor eczema or psoriasis. So you might want to use something that has lactic acid in it. That's great. I use a lactic acid moisturizer on my arms every day. I also use a little bit on my hands to help with skin exfoliation.
My boyfriend has a lotion that has lactic acid
Yep.
in it.
I'm just
for
like
that.
writing
Yeah.
it down. I'm literally like, okay, perfect.
Yep, and lactin.
Uh-huh.
Okay, last thing, and then I'm well, there's gonna be like 10 things, but that's fine. Okay, do you recommend gua sha and like dry brushing? Is this something that is a fad, or does it actually do anything?
I mean, these things have been around for centuries. So definitely, I think that there is some evidence and science behind them. They're increasing your lymphatic circulation. They're helping with skin turnover. I mean, are they going to be as effective as microneedling per se that goes deeper into the skin? No, but do they have their place? Yes.
Okay.
And if it helps you cope with life, go for it.
Why the frick not, right?
It feels so good. I love
It does
the
feel
little-
good on my face.
Yes.
Okay, this or that game, because I thought this would be kind of fun and we could just go every other. Okay. You're just going to basically say which one would you recommend somebody do. And if it's
these
both,
are-
it's just both. And it's
No,
hard though.
these are hard. You have to pick
Doesn't
one.
matter.
Should we make
I'm
her
making
pick
them
one?
hard.
Should we make her pick
Yeah,
one?
I'm making them hard.
But
But
you can't say both.
remember, you already had the routine above. You know what you're doing, but this I thought would just be kind of fun.
Okay.
Okay, hyaluronic acid or vitamin C? Starting with the hardest one.
My left hand, my right hand, or my first child or my second child? I mean, I would have to say both. But
Yep,
for
that's fair.
somebody my age, hyaluronic acid.
Okay.
For somebody your age, vitamin C.
Okay, good to
there
know.
we go. Retinol or sunscreen?
Again, both.
I know
Come
I'm
on,
I'm hurting you.
ladies,
I'm
come
sorry.
on.
I had to do it.
But it's got to be sunscreen because that has been shown to be the most damage. With
Yeah.
retinol, you're fixing, but the sunscreen, you're actually preventing.
Yeah.
okay, deal. So that's easy then, because next one is sunscreen or daily moisturizer.
Sunscreen all
Okay.
day long.
Got
so
it.
it's the number one factor you can control.
Exfoliator or gentle wash?
I think both have their place.
Yeah.
You don't want to over exfoliate. I mean, there's some regimens that use exfoliation every day and then you're actually like breaking your skin barrier. So, I mean, one day one day another. How's that?
Oh yeah, I like that. Paula's Choice BHA. I
Yep.
use that
Great.
sometimes.
She
Okay.
makes great products.
Love. Okay, good. Because I found her kind of early before people were talking about her, and I was worried it was just like a rando company. Basically.
And not that you have to worry about that, but for us as a woman of pigmented skin, Paula's Choice acids are not too harsh.
Oh, good. Okay. Amazing.
Paula's Choice. Remember?
I know. Yeah. Wait.
What do we think?
I don't know what we were like.
It sounded like a cookie brand or
Yeah,
something.
we couldn't remember what it was. We were like, what is that? We were like, Paula.
Paula's Choice.
2 product routine or 12 product routine, because this is a big thing for people. And like the things we were talking about in the beginning of like people recommending this whole line of 40 things.
Oh my God, who has time for that? And actually, it's sometimes
Three
too
products.
much.
3 product routines.
At
Sandwich.
the most, right?
Sandwich.
At the most.
I'm telling you right now,
Simple
though,
all day long.
She knows I was having some skin issues. I was getting these little tiny bumps under the skin over here by my chin. What do you know? It stopped after I used 17 products. I went to 3. It went away. Oh, Lord.
Too many
What's
cooks in the
interesting
kitchen.
about like Sydney's skin, like just for, I don't know, for visualization, I've noticed we already started them.
Oh, you did? Oh, you guys are ahead of me.
Yeah, girl.
Jeez.
Don't
Sorry
you
about that.
worry.
Sorry about that.
I noticed like Sid might get like, you might get like a zit, like all of a sudden a random zit because of your hormones.
Mm-hmm.
But your like actual pores are so freaking small.
They
You
really
have, like,
are.
Really?
And like
Thank you.
such good skin.
Oh,
but
thanks.
mine have like always have like texture. And do you see how my mic keeps slouching down? This is just
We'll fix it
so
after.
cute.
We'll make you so cute and tall.
But my skin, like I have I could pop blackheads in my nose when I was 7 years old. Like I would have my friends come watch me because we thought it was cool. But like my pores are just
Made it a thing.
big and it's like all over larger pores.
Can I tell you something good though?
Yeah.
When you are 70 years old, which trust me, it comes soon, you will look so much younger than your other 70-year-old people. People who have good, what's called sebaceous skin, good oil glands, they look so much younger.
But I went on
later
Accutane, so now I don't feel like my skin's as oily.
But you
So now I'm
still
like,
have the baseline like
Okay.
substrate of like
my dad
good.
does look young and I have his skin.
There you go.
Okay, cute.
You're set, honey. You're good. CeraVe or an expensive product of choice?
CeraVe and good gentle moisturizers like Vanna Cream or Cetaphil.
Okay.
Drugstore products or expensive products?
Whatever you like and what you will use.
Okay. Natural products or dermatology brand?
Dermatology brands have more science behind them, but you also may want to incorporate some natural products that don't make your skin inflamed.
Amazing. Okay. Wow. Look at that. That was kind of fun. It was kind of fun to go with this or that. Okay. I'm going to pick probably like 2 or 3 of these. Is that okay with you?
You pick 2, I'll pick 1.
Okay, deal. I'm reading because I have like a ton of, oh, you know what? This one is close to my heart because I actually used to have these breakouts and I figured out why. So it says, help, I have Bacne. It cannot make it go away. I'm careful with covering my back when I wash my hair to avoid hair product remains to clog my skin. I don't sweat too much or wear tight clothes. I just don't know if it's hormonal or what the heck I can do. And I will say, I was having really bad Bacne. Not bad, but like, I was like, what the hell is going on? I was keeping my sweaty workout clothes on too long.
Yes. And that's called fungal acne, actually.
Oh, cute. Yes. Right on the back.
The scientific name is called pityrosporum folliculitis. And it's typically from yeast overgrowing on the skin because the yeast feeds on sweat.
Delicious.
So you can buy, it's really simple. You can buy over the counter what's called ketoconazole, Keto, ketoconazole wash. And you could wash your back with it after you work out and it gets rid of the fungal acne.
Okay, deal. And for somebody who maybe it's not the workout related, do you have any advice?
Yes. Some acne in the body is what's called folliculitis, which is bacterial inflammation of the hair follicles. Benzoyl peroxide is phenomenal. Leave it on for a minute or 2 while you're washing your hair, shaving your legs, and then rinse it off because you really want that benzoyl peroxide to get into the pores.
Okay.
I love it.
Amazing.
This skin situation person wrote in and said, anything I can do for stretch marks on the butt?
Yes. Okay. So stretch marks, unfortunately, are very common as you grow, as you age, after you have children. Many people have stretch marks. It's a fallacy that you can prevent them. It's kind of just how your mom or your dad, how they aged. You want to keep them hydrated. You can use retinols. Interestingly, did you know that?
No,
you
I
can
did
use
not.
A little bit of retinol a couple
On
times
your
a
butt?
week. Oh, for sure. And it helps
Okay.
stimulate that collagen production. But microneedling is the gold standard for stretch marks. It helps
Really?
so much because it helps break up that aberrant collagen.
Can you go to your derm and say, okay, I'm going to do skin needling, but I want it on my butt cheeks?
all day long?
Oh my God.
All
that's
day
great
long.
to know.
Y'all, look at that.
Okay. So we know what we're doing.
Yes.
Okay, this person says, I love a good nail salon trip. I feel like I get so put together and I always want to have my nails done, but I heard a rumor that gel is horrible for you. Is the gel light for manicures the same as a tanning bed?
Yes. There is an increased risk of skin cancers on the nails. So some of my friends who are dermatologists who get their manicures actually get gloves.
I've seen that.
They wear gloves for everywhere else but their nails.
Wow,
So,
good to know.
I mean, easy enough. Just put sunscreen on. Put on a waterproof sunscreen before you go.
Oh, okay. Oh, so just put, sunscreen on your hands, basically.
For sure.
Okay, easy enough. Last thing, because you're going to read this, but I need to know because I put a little Botox right in my forehead and I'm loud and proud about it. So we
Yeah.
both are.
Yep.
Because I used to have a permanent line in my forehead from like this really, really active left eyebrow. Like seriously, there she goes again. And I'm glad I did that because I was getting a permanent line and now I literally don't have a permanent stretch line. Like, is it a bad thing if there's something that you're like really looking at if you're starting a little bit earlier than maybe quote unquote recommended?
Early intervention is the best because then your muscles are not making that pronounced line down the road. So
As long as you don't overdo it.
You'll be saving money down the road.
Really?
For sure. Yeah.
Especially in that instance, because it's
Never
specific to like a
overdo it.
movement. Really?
You should see somebody who has like a minimal aesthetic. You don't want to be the person who's like, oh my God, she's got a lot of work done.
Yeah, true.
And also, like, just a reminder, because we've had episodes about like we had guests on that were like, I will never put a needle in my face because I don't want to alter the way my body's aging. Like, aging is inevitable,
Absolutely.
and as females, like, I think it is so common and normal, and it's just so usual to think like we have to like alter that, I guess, completely. But like, you kind of have to make the choice for yourself. So I think like
Absolutely.
having a conversation like this is amazing. Like, if you want to get Botox because you have a line, like, do it. If you don't do it. Like, no one's forcing you to do anything. This is all just for you to have the information to kind of take what you want from the conversation. So,
And it's all about like, I literally do it so I like to feel good. Like my skin feels happy.
You
If that makes
wanna
sense. Like, that's
approach
why
the
I use the
world
products I use. Like,
with your
you know?
best, with how you feel confident.
yeah, I
Right.
love that. Oh.
yeah. So I guess what would you say to like people that are maybe really against even just anti-aging products?
We have people
Because-
writing in about their boyfriends.
Well,
Oh.
Like, no, like keep going. Cause I'm saying like people writing about their boyfriends, like saying like, my boyfriend's weird about Botox.
Oh, yes.
That's like what I thought that's what you're saying. So
that's
I'm
exactly
like,
what I
okay.
was saying. That's a good point. But exactly, like sometimes people are like hiding their procedures from their husbands because they're the same men that are judging them for getting a little Botox or buying the expensive face cream, but yet they're also the same men that are liking and holding these beauty standards.
Absolutely. It's such a double-edged sword. Women, we are just, and men too, are subject to such a double-edged sword.
Yeah.
You should do what makes you feel good. Like I said, so many people come to me and they don't tell their husbands what they're doing, or they don't tell their, significant others what they're doing. You should be open. You should, like, this is your face. You just want to make it feel as best as you can.
Yeah. Yeah.
And
Love
boys
that.
should not be afraid to do that either. Like Jordan, he's a pamper boy. Like you see him, he loves a good pamper. He loves a little something. And guess what?
Life is
he
short.
had a little like permanent crater scar from a pretty bad acne scar, and he was so self-conscious about it. And I looked at him and I go, I'm like, babe, I don't see it.
And he's
like
such a handsome
he's so
young man,
handsome. He's
yes.
so beautiful. And I'm like, babe, I don't see it, but do whatever you got to do. And he's like, it makes me self-conscious. Like he actually like was so self-conscious of it.
He's
And
gonna
so
be
we
like,
get-
he's gonna
we got
come
the
to you,
laser.
Sid. What did you say?
I know,
You
he's gonna
don't
be
know
pissed.
what
I know.
makes other
Oops, I
people
just like totally
self-conscious.
gleeked, but
You don't
I know.
know. Like, you don't know, like, probably maybe nobody noticed this on you,
Yes,
but it
but
made you feel
it
self-conscious.
does, and I see it in the
now
mirror from me
you
right
approach
now.
the world in a better way because it's gone.
Exactly.
I love so I also got Botox, and it's so funny because I don't like it right away. I like it when it's like kind of wearing off because
Yeah.
I can still have like right now it's perfect. Like I can
So
still have like
maybe
some
you need a
facial
lower
expressions.
So maybe
because I can still
there's
move around.
also what's called baby Botox where you do a lower dose but more frequently. And I love that for
okay,
young
smart.
people. You end up being in the office a little bit more, but
Yeah.
you end up spending the same amount of money.
True.
Yeah.
Okay,
So-
true.
What's just to say on the other side really quick before you read your straight candid moment of like, people are like, well, no, if you're putting into your skin, you're technically like expanding the skin. So like it might actually not be preventative. Like wait until you're 40, blah, blah, blah. I'm just saying we hear literally everything. I'm telling you, TikTok.
That's
People
not the
in the-
science. The science is that it's blocking the neuromuscular junction from contracting. So you're not expanding anything. You're just helping the contraction.
I'm sorry. Boom roasted, people.
Or are you talking about filler too?
Oh, well, maybe I am. Well, also it's filler too, but that we talked about that for putting it into under eye. If that's something that's bothering you, if you like lose the, I call it substance under
Yeah,
your
the
eye.
collagen,
Okay.
yeah.
I was like, I don't know what it is.
Yeah.
I'm like substance, whatever is here.
Wow, what a good conversation.
You're
This is-
amazing.
Wow,
Thank you
I've
for
learned
having
so
you.
much.
I know. I'm like, oh
But
my
I
God.
do have
One
something.
honest, real conversation.
Yes.
Yes.
And that's all we do
Seriously.
is like candid everything.
I love it.
And I hope your husband learned something too from us too.
Can you show us
He's going to be pissed.
Can you show us what mug you're drinking out of? Did you like it?
I loved it. Look at this, guys.
What's it say?
I don't know. Oh, girls poop.
You didn't even notice.
You didn't even see your mug.
I know I have to take this and
I know,
show this
yeah.
to my own daughter because we always say that.
You
Oh my God. Do you really? We've got that
can,
merch.
She can keep it.
You
'cause
can
we'll
have
order
that
one.
cup.
No.
Yes, you can. It's our
You
mug.
have to take it and bring it to the office and tell everyone where you got it. Guys, girls poop mugs are officially on the site. So
We got merch on there, so you better go
check it out. Check it out. All right, but before we wrap up completely, I have a listener straight candid moment.
I'm
so a listener
excited.
wrote in, and this is about a little pimple. So I thought it was very fitting for this episode. Okay, she says, hope you thoroughly enjoyed the straight candid moment. So a couple months ago, I felt a throbbing pain between my butt cheeks. Cute, right? Well, after some examination, this is a funny image in itself, and I'll let you use your imagination to how I examined my inner booty cheeks. I found out I had a pimple between my crack. I've had ear pimples, armpit pimples, on the bump pimples, but between my booty cheeks, really, it was right at the base of my tailbone. It was so painful, and even worse, I couldn't reach it. I had two choices: call my mom as a 25-year-old or ask my boyfriend that I'd been dating for a year. After writing a pros and cons list, I decided to ask my boyfriend because you know what? If he can't handle me at my worst, he doesn't deserve me at my best.
Slay.
He ended up dying laughing, and I don't know how, but it ended up turning him on, and we had a happy ending. A complete, clean zit pop, and well, you get the picture. Love you guys so much, and happy I was able to share a humiliating moment publicly and anonymously. Writing in my straight candid moments is seriously my new favorite outlet. Who needs diaries these days? I was like, I love that.
Wait, why? It was almost like a kind of a cute moment, and I'm like, what? In what way was that cute? I'm like, oh, good for them.
So cute. He popped her
See the impact you guys have on the world.
We're trying. We're trying to spread our goodness. That's all we're trying to do.
We're just
amazing.
trying to let you know booty pimples are okay.
They're okay, sisters.
And maybe
It's okay.
beyond okay.
Right?
Yeah, literally. Apparently they
Sounds
are
like
beyond
it.
okay.
Oh my God.
Dr. Tareen, you're amazing, like in every freaking way, shape, and form. And Natalie, thanks for being here. You're amazing as well. Like literally, we were so excited to have you on. So
Where can people find you, see you, follow you?
all the things.
I'll let Nat take that.
Oh,
Nat, you gotta come to the
You
mic.
gotta come over. She's coming to the mic now.
You don't need the headphones.
If you don't want them.
You can find us on our website.
Closer.
Ooh.
You can find us on social media, TikTok, Instagram, Twitter, LinkedIn, Facebook. We're everywhere. But
What are you called? What do we look?
Tareen Dermatology.
Okay, for everything.
Tareen.
Okay.
Tareen Dermatology.
Perfect.
You have a nice podcast
Yeah,
voice,
wow.
by the way.
Oh, hey, thanks.
That was sensual.
Oh, thanks.
You should
Wow.
do some of our ads or something. Oh my God, it was very sexy. Thank you guys.
Thank
We
you guys
love
for
you.
coming on.
Bye.
I said thank you guys for coming on, and I meant to say thank you guys for listening. Tareen for coming on.
Tareen for coming on. Okay, we're out of here. Bye.
Word.
That was super fun.
Was that good?
Yes, it was super good.
That was a
You're-
great episode.
You're so easy to speak with.
Oh my God,
You
really?
are too.
Thank you.
Seriously.
You're so freaking knowledgeable. It's insane.